Hey everyone, today we're diving into a hot topic in regenerative medicine. Are stem cells legal? So, to help us unpack this truth, we brought in two experts for a regenerative workshop that we held. Dr. Jason Minsky, who is a leading expert in regenerative therapies, and Dr. Michelle Brown, who is a physician and attorney who specializes in biologics. So we asked these questions directly to them, and I wanted to share the response with you because I think it's a really, really important question to understand and to look at so you can make an informed decision about what's right for you. So here's what they had to say. In terms of when you're sourcing, you said there's 5 labs that produce this stuff and you want US based. What is the concern? Is it that it's just not going to be effective versus I don't know, there's going to be mold or something in the exosome?
Oh, I mean, I'll give you a real world example. So I was contacted by a big clinic down in Costa Rica. Some of you may have heard of it, and they were trying to recruit me to send people down there. So obviously, I had questions. My biggest question was like, why would we send people down there if we can do what you do here?
Mhm.
And I said, well, um, you can't do what we do here. And I said, well, okay, explain that. And they said, well, it's proprietary. And I said, well, that doesn't make any sense. This is medical. It's not, you're not reinventing something. It's medical. So let's help all the people who can help. Tell me what your process is so I can make sure it's safe. So they wouldn't give me that information. So we never did anything together. But also too, outside of the United States, there's different laws, right? Different regulations. So I don't know what's going in your treatment if you're in Guatemala, Costa Rica. I'm not saying they're bad. But I just don't know. So I've heard of people that got results from it. Great. Still don't know. So in the United States, we're very conservative medically, based on laws and all of that. So a good part about that is you do know what's going in you, right? And so the advantage in the US is you know exactly what's happening. Some would say a disadvantage is that you can't culture and manipulate cells outside of a clinical study. So that would be the key difference. Now, again, I don't know if they're doing it, if it's happening. I don't know if they're putting saline in you or what's happening outside you because there's no regulation to watch it. Um, and then, so the other side of importing stuff into the US, same thing. They can't control the manufacturing or procurement process. So they can't tell you exactly what's going to be in it. So the danger of somebody using something derived that's a biologic from outside the US is it's illegal.
That's a big problem.
It is a big problem. And I try not to scare people. And again, I'm not an attorney and anything like that. So there's probably gray area and loopholes like everything else. And I don't know all of those. But what I do know is that it the authorities have deemed it unsafe that if it's not procured or manufactured in the US because they don't know what's in it, that they advise against using it. And there are laws that say that. So they're protecting, and I think that's okay. I don't mind that. I like advancement in medicine, but I don't necessarily believe in everybody being a guinea pig.
Right.
So
And I will say that I've had a couple of patients say to me when we talk about regenerative therapy that and they'll say they're thinking about going to Mexico or Costa Rica because it's not legal here. And I don't understand where that comes from or why there's that perception that this stuff isn't legal in the United States.
marketing. It's marketing. It's like anything else. When companies are going to tell you we have 10 million cells or we have 100 million cells. Well, if you can't culture and manipulate it, how do you know how many cells, right? And so like I can give you an average number, but I can't give you exact because it's not how we do it. It's not the process that's approved in the US. Um, so it's marketing. And when you talk to, well, you got to come down to Costa Rica because we have a proprietary method and you can't get that in the United States because it's illegal to do it. It's, I don't know what you're doing, so I can't, understand if it is illegal or not. But however, in the US, yes, you can use biologics on it for medical necessity under, you know, the proper scope. So if you have the right license or whatever else to apply it, then the state governing board says it's, look, Florida and Utah just passed laws that specifically said you can use it under, proper medical guidelines. In other states, they haven't passed a law, but they haven't passed a law against it either. So, um, you know, it's not illegal. It's just that people want you to come to Costa Rica and they spend a lot of money building a clinic in Costa Rica. They're going to tell you it is.
So I first got into the regenerative space probably like in 2019-ish, and there was some laboratories out in Utah that were advertising that they were selling biological products from the Utah Cord Bank, and I guess the Utah Cord Bank would somehow get these products, and then physicians could buy them, and then they would use them. And so I started studying it then. And then in 2000, like a lot of people were really interested in the stem cell stuff. And it really got to be the wild, wild west out there. You were getting stem cells from China, Korea, these cord banks and different places. And as you know, stem cells are biological products that, if they're made correctly in a pharmaceutical manufacturing laboratory, they technically are made according to drug regulations. But stem cells have not received any type of FDA clearance to be considered a drug at this point. And I'm not sure if it's because the studies that the FDA is doing isn't complete, or they're having legal challenges to whether or not they can patent a human biological type of thing. So the legal and the FDA ramifications are pretty big. But at that point, though, in 2000, the FDA was very concerned that there was a lot of dangerous products out there. There were a lot of products being sold as potent stem cells that contain like zero signaling proteins and no human cells. I mean, it was really bad. So the FDA issued a guidance in around 2000 that basically said you cannot advertise claims or cures for biological products that are not drugs and cleared by the FDA. So a lot of people misunderstood this guidance about these type of products to say, oh my God, they're saying it's illegal and you can't use them. Well, the truth of the matter is the FDA is not a governing body that promulgates laws. It's a governmental administrative agency that issues guidance about drug safeties, and it does have an approval arm for implementing new drugs into the chain. But so I think there was a lot of misunderstanding about what that guidance that was issued said. And also, I think they were out trying to prosecute and stop these characters that were introducing dangerous products into the market. So since that time, you have to be very careful about doing advertising saying you're using stem cells and exosomes that can treat specific diseases. There are a few states that have promulgated their own stem cell laws, like Utah and Florida specifically, that outlines the specific use of stem cell and exosome products by physicians. And these states are allowing advertisements with full disclosures. So I think if you're interested in getting into this space, you should immediately check your state law to see if you have any, I would say, like state protection or state legitimacy laws that say, hey, we recognize that these biological products can really benefit people. And there is a federal law that's called Right to Try that allows anybody the right to try experimental new treatments, that haven't been cleared through the FDA. So start with that. Find out, what your state says. Most states do not have any law. Actually, I don't know any state that has a law that says the use of donated biological tissue is illegal to use. There are some laws out there that say aborted fetal tissue is, definitely a no-no. But our products would never come from aborted fetal tissue. But that being said, you don't really know where a lot of these supplies that come out of country come from. Mm-hmm. So I think, when the concern about, oh, it could be illegal here in the United States to use them, a lot of these unreputable clinics started opening up in Mexico, and they're charging people like so much money. I'm not opposed to making a good profit on your treatments, but one of the things that our founder, Dr. Farshian, has always held close to his heart is that you have to be in this space for the right reasons. You can't, just charge people and don't give them a good product or a good treatment, because the goal is to really help people that have degenerative diseases or pain or whatever you're treating. So I think you're finding here, especially in Florida, stem cell and exosome treatments are very, very affordable, and people aren't being gouged for the cost. So I would not recommend that anybody to go to Mexico, because even though Mexico has their own FDA there, it's really uncertain what a lot of these products are that they're using in Mexico.
Yeah. So the stuff that, like for the Center of Regenerative Medicine, that's all US based donated perinatal tissue.
Yeah, and actually, I just recently heard that most of our donations come from Indiana for some reason, and I'm not sure why, but we do get donations from other areas, but maybe there's more C-sections in Indiana. I'm not sure, but yeah, no, we don't take foreign donations of our products.
And there you have it. So there's a lot of misinformation out there, but you don't need to go outside of the United States for safe, effective regenerative therapies. They are right here in the United States. We offer them at the Philly Wellness Center. There's probably a place nearby you that offers them as well. So if you want cutting edge treatments, we source all of our biologics through the Center of Regenerative Medicine that Dr. Michelle Brown was talking about, as well as through Dr. Jason Minsky. So through these two sources, high quality US-based products that you can be confident in. So we're happy to discuss what your options are with you. If you want to contact us, schedule an appointment, and let's just chat about what's going on with you and to see if biologics can be a part of your healthcare regimen. All right, thanks for watching. Make sure you like and subscribe to the channel, and please reach out if you have any questions. Thanks.